Yes.
Good evening.
Yeah, good evening.
Yes, I made you the co-host. You can do it now. Vinny.
Yeah,
Vinny, check.
yeah, I can.
Yeah.
I can do
So
that.
let me.
But I give you the
Yes.
control already, so you can move the mouse, so you can go forward and backward. You can try.
I have tried. Nothing is coming up. You have to try yourself.
Okay, okay. So if you
Even if
say
you give
next,
me, I did not receive that control.
yeah, if you say next, then I'll move.
Okay, yes. Now let me give you some notes and this one. See, Tung acupuncture is very different from TCM acupuncture. Don't come up to this picture now. I'm going to tell you something from my brain. Half of the things are stored. I don't write everything. So when I speak about Tung acupuncture, it is very different from TCM and other acupuncture techniques. You know why? Because it does not take any TCM principle for the treatment of the disease. It was said Master Tung followed his own family lineage, and he was an army soldier, and he treated large number of people in the army during his tenure. Even if you see my previous career, in my career I was very long associated with the army people and the paramilitary people, and there I used to treat the most critical, painful problems of the people, and that is the reason I achieved this type of command in treatment of the brain. Similarly, Master Tung was an army soldier. During the World War II, he treated large number of people. But then once he was invited to what? As a university, and he treated one paralysis patient by just inserting 2 or 3 needles in the palm, and he recovered. Then what did Master Tung said? You know, he was removed from that. He has to leave and run away to from China, and he ran away to what? Taiwan, and that is why Tung acupuncture was never famous in China, because it was against their traditional belief. It was against their traditional approach. Because Chinese principles followed tongue diagnosis, pulse diagnosis, palpitations, and various techniques. In Japanese method, if you see, they follow what? They follow the Hara diagnosis, the abdominal diagnosis. So in Tung acupuncture,
Right? Nandini mo yun? Me. Nandini nga points.
please switch off your mics. So Master Tung and Master Ten, they were two one of the scholars who came with different methods of treatment. Master Ten rather followed the Master Tung style of treatment. Master Tung and Master Ten. Master Ten had a credit of teaching how many acupuncturists around the world. He taught around more than 5,000 to 20,000, not 20,000, I think 200 and more than 100,000 acupuncturists around the world. He died with cancer, but professionally, all these good acupuncturists were engineers like our Dr. Roni. And then when Master Ten could not, who could sue the plight, in his book he had mentioned, I forgot the name of the book, I studied all. What did he mention? He mentioned the plight of acupuncturists in America, that they take a huge bank loan and they are not able to produce results. And as a result, what happened? They come under huge bank activities and their career is doomed. That is why Master Ten studied the I Ching principles. The I Ching means the book of changes. And then he came up with 7 balance method. Ideally, it was said that Master Ten was a follower of Ching Cheng Chow. And then he was also the follower of Master Tung. And so if you see, Mariam Lee book was forwarded by who? Mariam Lee book was forwarded by Master whom? Master Tan. If you read the Tong's acupuncture book. This book which I have written is around 5 to 6 years back or more than that. But these days, I have stopped practicing Tung acupuncture because my research, I upgraded other part of the treatment because I worked with most difficult conditions where I believe that Tung acupuncture needed to be upgraded to other level of thought. Master 10 principles were very good for symptomatic recovery, but when certain recovery came, Master 10 principles also failed. So what did I do? I took out some combinations. So during this combination, I found 3 principles of treatment in neurogenic conditions. Please write down the notes. What are the 3 principles of the conditions of the treatment? Reduce the pain.
Reduce the pain.
Second principle, stimulate the nerve.
Stimulate the nerves.
Remove the extra spasm and pressure on the nerve.
Remove the extra spasm
Spasm.
in the nerves.
Yes. Tonify, strengthen the muscle. Tonify the muscle.
Tonify or
Because in any neurogenic conditions, yes, tonify the muscle. And fourth principle is what? Fifth principle, coordinate with the brain.
coordinate with the brain.
Yeah, muscle has to coordinate with the brain.
Coordinate
So when
muscles.
yes,
Okay.
so when I speak,
What is your fourth principle?
how you, Kradya, what is the fourth one?
Fourth
Please
principle.
repeat one by one.
Yes.
25.
First principle is reduce the pain. Second is stimulate the
See,
nerves.
one minute.
Sorry.
In any primary treatment, whenever there is acute pain, first is what? To immediately reduce the pain. What you start doing is what? The local treatment. Local treatment Treating the area locally may sometimes increase the inflammation of the area.
Increase inflammation of the area.
Yes, it may increase the inflammation of the area.
Sir, this is for the acute cases, right?
Huh?
This is for the acute cases.
What you are saying?
Yes, in any acute treatment.
Yeah, see, question is that acute or chronic is not bothered here. Now the question is that if the patient has come with acute pain, severe pain, in chronic cases also you have acute pain.
Oh, okay.
In osteoarthritis, you see there is no pain in grade 3. At VAS scale, the pain is 10/4. But suddenly the pain aggravates and it becomes 10/10. What will you do at that moment? Your duty is to reduce the pain first. Right?
Yes.
And that also you should do what? Distally. You should do distally.
Distilling?
A distal. Distally means treating from the contralateral side. If you see, if you see the yellow emperor, I think it is chapter 7 or 12, in which he has mentioned the various procedures of treatment, in which he said the contralateral needling is important. Treating smaller joint, bigger joint with the smaller areas.
Treating bigger joints with
Smaller areas.
smaller areas.
Yeah, smaller areas and distal areas.
And distal area.
Now you would like to know why am I teaching you this? Because it will give you an immediate whatever you have taught right now, whatever I have taught you by now, you can integrate this knowledge with integrative medicine so that at least you can become a good pain recovery person. Because these points are called magical points. Once you use these points and integrate it with some other techniques, you get what? Instant results. You can reduce pain below 20 seconds. Insert the needle and the pain is gone. But then you have to work with the localized problems. So these are the 5 principles of pain management under Tung acupuncture. What was there? Number 1,
Reduce
the pain. Yes. Reduce pain instantly.
Okay, instantly.
Yes. Reduce the pain instantly and fast.
And fast.
1 minute. Dr. Eli, I have started the Tung class. Will you like to join it? I've started a Tung. I told you now I'll start the Tung.
Yes, I like to join, sir.
You'll love to know one of my good friend, Dr. Farooq Ilahi, is a PhD scholar who has completed his what? He has completed his medical degree.
PhD degree recently, very recently.
Medical degree. First year for is a medical doctor. Then he's a homeopath, and then he's a specialized in gynecological cases. His son is a CTVS surgeon. Me and he is a very good friend, and he will be joining us today to learn Tung acupuncture from me. See, basically, I was working in a very difficult conditions of the medical people. It does not mean that we people run with our degrees and these profiles. I can bet on one thing. That people do not know the gravity of medical science, and that is why they cannot perform a good treatment in that clinic. You know, why did I use Tung acupuncture? I was supposed to use Tung acupuncture because I'm just waiting for Dr. Ilhai to join. Anyway. And then you can compare what is taught in Sangha University, what we are learning here is totally different. If anyone can challenge me as a medical physician, I can also tell him, please, we are ready to accept your challenges. Before speaking something, you should have a strong research background and also a clinical background. This is what we miss today. We miss our clinical background. We see only 20 patients a day, and in 2 or 3 or 4 or 5 years experience, we conclude something. Whatever we used to do our time has totally changed. Why did I leave Tung acupuncture? Because I found out a better methods. But for the beginners, Tung acupuncture is a very good encouragement in integrative medicine. Because you use very few needles, instant recovery, use NIBS, tonify the muscles, use the neuroanatomy to recover paralysis, and it becomes very easy. I'm just waiting. Let's see. Dr. Eli, are you there? Dr. Sheikh Farooq Ilahi. Let's check if he has come. So when you speak, let me just wait for him. Dr. Eli, are you there? Anyway. Dr. Eli, are you there? We need just keep checking, huh?
His name Eli?
Yeah, Dr. Ilahi, E-L-A-H-H,
Oh,
Sheikh Farooq
okay.
Ilahi.
I'm trying to find out.
He's from Bangladesh. So, we made many control trials. When I started teaching in Tung Acupuncture, I was the first one to teach in the Mumbai seminar, in India at least. After that, the Tung was spread up in India. I was the first one to teach Yamamoto. Then I gave my slides openly to everyone. And then it gradually spread up. You know what was my problem of Tung Acupuncture? My problem was that I knew nothing about Tung Acupuncture. I was always interested to learn, but the question was that we did not have money to learn because Brad Wisnet, Robert Chu, their classes was very costly. You have to go to United States, you have to learn from them. And the more important part of their class was that what? They used to teach part by part. Part module A, this one, part B, this one, part C, this one, part D, this one. And ultimately the whole course module becomes what, 4,000 to 5,000 US dollars. It was not possible for me. And then there was a battle between me and Robert Wisnet. He went to the extent of telling me this and that, and then he said Indians are beggars. Robert Chu was the person who said Indians are the beggars. Then I got so annoyed that if this is the approach as a physician, you say people like beggars, you say, see, we cannot afford, means our cost per dollar is 75 times higher. How can we afford? For you, $1 is 1 rupee, but for us, $1 is 75 times. So when it becomes $350, it becomes what? Our total month salary. How will our physiotherapists and other people afford to study these costly classes? And that is why I took the initiative. And that is why my knowledge of parapsychiatry was done. I was inspired to write a book on it. Dr. Eli, did you enter the link? Hello? Hello? Hello, can you hear me?
Yes, we can hear.
Not you, Dr. Eli.
Unmute good.
Oh, he has entered. Sorry.
Hello, yes. Hello, Dr. Sastry.
Ah, Dr. Eli.
Yes,
Yes,
yes.
yes. Thank you, Dr. Ilahi.
Okay.
Thank you so much.
ठीक है.
This is my this is my very good friend. One of the most, you can say, we know each other from last 10 years. And the most marvelous part is that I saw his journey from an acupuncturist to a super acupuncturist. He was the one who loved education more than anything. And Dr. Eli, whatever I write about him is like ants explaining about the hill.
Go on.
So let us come some principles so that he can understand. I'll repeat certain things others can say. Dr. Eli is a medical doctor. He has a very vast knowledge. He has done his medical graduation from which medical college?
This is Sylhet Medical College.
He has done his medical graduation. Sylhet Medical College. And then he was having a profound knowledge in gynecology. Then he studied homeopathy. And I don't know what he studied after that. And then he was a student and alumni of College of, which College of London?
Royal London Homeopathic Hospital.
Yes, one of the profound medical college in homeopathy. Then he studied homeopathy with many Indian doctors. Then he studied at IIRI acupuncture, started his acupuncture journey from there. Then he went to do his advanced diploma in Shanghai University. From there again, he was inspired to complete his, after completing his 4 months diploma, he was inspired to complete his PhD in Shanghai University. And then he did his PhD in a very beautiful topic, including acupuncture, laser acupuncture, and laser moxibustion. I think laser moxibustion?
Yeah.
Yeah, Dr. Eli is one of the rarest person who has done his PhD. Ronnie, you can talk to him. He has done his laser acupuncture PhD from Shanghai University by using what were the points? CV6, stomach 36, and
Hi, it's my friend.
CV4, CV6,
okay.
and CV12.
Hi, Professor
What was
Sheikh.
your point?
Professor Sheikh brought me here. Friends too.
Oh, your friends, okay, right. So, Farooq, Dr. Eli, Ronnie conveyed your regards to him. You know him, he's your friend. He's working in laser acupuncture.
Who is Ronnie, na?
Ronnie from Singapore. Ronnie from Singapore is my student.
Okay.
So now we'll start our tongue. But before that, I like to say, teaching near Dr. Eli is like getting somewhere nervous.
But
You are
your
teaching
sound,
what you called. Yeah. Can you hear me?
your sound is little bit low volume, I think.
No. Your volume is going low. You have to increase your volume. My volume is okay, sir.
Okay.
You have to cut down your internet. Yes. If someone is calling your mobile, you have to cut down that connection.
Okay, no
So
problem.
that you can hear
I'll
me.
cut it. I'll cut it.
Yes.
Okay.
Yeah. So see, tongue acupuncture has been a different school. See, it is said in China that with your due permission, Dr. Eli, I start my class.
Yeah, sure. Oh.
So there are around 252 students. In general, there are around 300. But because of Ramadan, many people in Indonesia, Malaysia, they are taking a leave, right? And generally, people are from 16 countries. Most of them are non-acupuncturists. Some have done 2 years diploma in Philippines and all acupuncture, but they don't have many things about what you call they don't have a background of too much study in acupuncture. So far, I am concerned. See, the best part is that I've studied 5 types of medical science: Indian Ayurveda.
This is the highest. তাহলে ওনারে আস্তে কথা বলতেছে।
আর আপনার ছেলে
এত করে sound দিবা।
আপনার ছেলে তাক বলছে না, আমি একটু বুঝতে পারি তো।
ও বাড়া। Okay. Yes, yes.
For the first time I met your son, a
Ah.
CTVS surgeon. Thank you so much. See, most important thing I want to tell you about my career is that I've been working in 20 hospitals, but I was the founder of certain subjects in India, because the most important part when we see in our clinic was that we used to get the chronic and critical cases. When I speak about the chronic and critical cases, chronic means what? The patient has gone through various stages of disease, and now under conservative medicines, this disease was not been treatable. These cases were required for replacements. These diseases were required for replacements, and this disease has required lot of treatment, and even the recovery was very less. And when we started with this TCM principles, we had some setback. The setback was that maybe our knowledge was not that up to the mark. So we created our own principles of treatment. So our 5 principles of treatment was what? Whenever there is acute pain, treat the pain distally, and that is why tongue acupuncture was more attractive, because fewer needles and the pain was to be treated distally. That means what? If you have a pain in the knee, you treat it with PC6, Heart 7. Put 2 needles here, and the acute pain of the knee is gone. Now, if you have a migraine here, put 2 needles touching the bone of 3 tooth, 75 mm. Touch the bone. In GB 31 and 32, your migraine pain gone instantly. And that is why tongue acupuncture became very famous in the world. It became most popular in America, not in China, because Chinese people had a different approach for treatment, and it was against TCM culture of treatment. And then later on, certain neurosurgeons like Dr. Woody Pong, Zhao Sunfa, they added certain principles to their own treatment. So what did I do? I modified Zhao Sunfa using neuroanatomy, and then I integrated it with tongue acupuncture. And that is why I came out with 5 principles of treatment. What are the 5 principles? If there is any acute and chronic pain, treat it distally, fewer needles, then tonify the muscles, coordinate it with the brain, and 5th one, the most important one also, is that
Remove the extra spasm.
no, extra spasm also reduced with the pain. When you work with the pain, spasm can be reduced. So when you put when you strengthen the muscles, the spasm will be reduced. And that reduction can be done by inserting 2 or 3 needles by creating work in the parietal lobe of the brain, which I already taught you in the previous class on the neuroanatomy. The most important part of tongue acupuncture was what? It said about the neuroscience principles. And that is why when Master Tung taught this technique in China, he was supposed to be jailed, and he went to Taiwan. And that is why in Taiwan, tongue acupuncture is more famous than the TCM treatment. It was a wise saying. Someone asked me when I was teaching a batch of American doctors, medical doctors in Italy and America recently. They asked me one beautiful question. So there are so many schools. Which school should we follow in acupuncture? It's a Japanese technique. In Japan also 5-6 techniques. In China, it's another big technique of TCM principles. Again, you bought so many techniques. Which should we follow? Then I said, this is a beautiful garden with beautiful flowers, and every flower has its own nectar. And so, when Master Tung had his famous disciples, who were the famous disciples? He had 64 disciples. In these 64 disciples, Wei Chi Yang was one of the most famous ones. But it was said Wei Chi Yang was always to be removed from the class because the Paul Carson was he was a Tibetan. He
Sir, we can't hear you well.
Master Tung, and you cannot hear me?
Your voice
Yes,
is
sir.
cracking.
It's a bit cracking and
Tape
choppy.
on and off.
Okay, now
Now it's quite
Now,
clear.
yes, okay.
wait a minute. Now it is clear?
Yes, it's clear now.
Yes.
Yes, sir. Clear down.
Yes. Now when I
Loud
was
and clear.
speaking, yes. Now I'll repeat certain point. See, Master. Yeah, Wei Chi Yang. Wei Chi Yang. There were 64 disciples. The famous was Wei Chi Yang, Mariam Lee, and Paul Carson. Paul Carson was a Tibetan fellow, along with 64 disciples. Paul Carson was a Tibetan fellow, and his students were, I forgot the name of his students, but Wei Chi Yang students were Brad Wisnet, Robert Chu. They followed the Wei Chi Yang clan, and Paul Carson had his. Susan Johnson was from Wei Chi Yang. Susan Johnson was from Wei Chi Yang group.
Yes, sir. So,
Yeah, no. Susan Johnson was from Wei Chi Yang, but there are certain Throsu and all those were from Canada, Australia. They followed somewhere Paul Carson. Italians followed Paul Carson. So the first one to write Tung book was Dr. Paul Carson. Dr. Elahi, can you hear me? Dr. Elahi?
Yes, I am following.
Yeah. Thank you so much. So Paul Carson was the first person to write a book on Tung acupuncture. And the most important part in Chinese culture, what Mr. Tung always used to say, that it was a family lineage. And people in China, it was said that they only used to teach the eldest son. This was what Master Tung said. And rather, they never used to teach the youngest boy also and daughter also, because they were afraid of sharing this tradition to other people. If you go to the history of Chinese culture, acupuncture was betrayed by many Chinese rulers. Lot of autocracies was done. And similarly in India also, it was doing a very excellent work, but then it was lot of autocracies was done. And that is why the most beautiful books of Tung acupuncture and all this was burned. But then Master Tung made his own chart and started teaching the people. And Tung acupuncture carried around 1200 points. How many points? 1200 points. But now, what are the fine principles of Tung acupuncture? Tung acupuncture was said, the method of insertion of the needle. The method of insertion of the needle was what?
Dharma,
Very normal.
distal,
It is said that muscle treats the muscle. So the same points are used for multiple combinations. For example, you are treating the psoriasis. So you are using certain point. It also treats the pain. So when you treat a muscle condition, the needle has to be cellulally inserted. It has to be inserted in the cellular level.
bone treats the bone.
Wait a minute, Siddeshwar, let me complete. Can you see my slides?
Yes, sir.
Can you see my slides?
Yes, sir.
Yes.
Yes, I am comfortable now.
How about going to the slideshow? Can you?
I have given the slide, so can you see it?
No, it is not the slideshow
Not
mode.
yet.
Full screen, please, sir. Full screen.
I've given the full screen. Now you see?
Yes, sir. Yes, sir. Okay, okay.
Yes.
Thank you.
Yes, thank you.
Thank you so much. Yes. So, see, TCM principle are based on tongue, pulse, diagnosis, right? Tongue, pulse, and palpitations, observations. They have their own observations, but Tung acupuncture was not based on this diagnosis. It was rather based on clinical symptoms. So you will see there are many points which were identical in Tung point and TCM point, but then Master Tung did not give them what? He gave them a switch off your mic. So Master Tung always gave what? Certain principles of the treatment. He said the same points or can treat many diseases. So he took out what? The combination of disease, and that was called Dao Ma treatment. What it was called? Dao Ma. And that is very important that we must know when we treat the patient in integrative medicine. I worked with functional MRI and all. So when we inserted the needle, we saw how which area of the brain was reacting, and we saw the clinical symptoms subsided in seconds. We have done many trials. Even in the Facebook, you will find out certain trials which we did in Mumbai 6 years back. We used to take the stopwatch and we used to see how much seconds the pain used to subside. And more than 20 doctors used to do the trial. A few are allopathic doctors, then homeopathy doctors, professors, and other people. Then I came across with Japanese technique. It was the most wonderful technique because when you work with the most critical problems, chronic fatigue syndrome and all, Japanese techniques gives you better recovery and instant recovery. Very good. Then I encountered what? I encountered with Yamamoto technique of scalp acupuncture. But then in Yamamoto and Zhao Sunfa, the problem was what? It was 50 years old technique or 30 years old technique in which the clinical manifestations of the disease was not clear. So what did I do? I studied neuroanatomy and I collided with Tung acupuncture. Then I included 10 balance method from I Ching. The most and oldest technique in Chinese principle is the I Ching principle of acupuncture. In I Ching principles, there are how many principles? 64. But then again, if you see the books of Master 10, Richard 10, he wrote 12 more and 24 more. These two books are based on what? Tung acupuncture.
It was I Ching.
No, sir. It was Tung acupoint, 12 more and 24 more. The balance methods, global balance method, the seasonal balance method, and all this came from the I Ching. But when 21 and 24 book, 21 and 12 more points and 24 more points was written, it was a Tung point which he has written. It was not I Ching. And these points were called distal acupuncture points because distal acupuncture means treat the pain distally, treat the conditions distally. Treat the conditions.
That is correct?
May I know speaking? Hello. Treat
This is Afzal.
Afzal from?
Bangalore, India.
Afzal, please don't disturb me when I take the class, right?
Yes, sir.
So when you treat a pain, you have to treat the pain distally. This was the first principle. Master Tung used to say, if there is a pain in the knee and if you to put an injection there, he used to call it injection like a nurse, then that is not acupuncture in my sense. It was his opinion, not mine. Okay. I'm quoting the sentence of Master Tung. Please do not mistake it with my treatment. I always say, integrate everything. Whatever is best, whatever you can take out from anywhere, please integrate and treat it. And that is why when I used to work in the cancer management cases, many people think I am not a medical doctor, but I always laugh at their principles. I don't like to say I am a medical doctor because I don't enjoy writing medicines anymore. If I write medical doctor, what will happen, you know? In India, it's a famous saying, they will come for medicines to me. And I don't want to write medicines. Because already they have consumed so much medicines. Now I want to reduce that. I want to taper their medicines. And this was a very effective tool. Our method of treatment was work. I visited this hospital for 15 years. I visited these hospitals in around Assam. 25, earlier I used to visit 25 hospitals. So from last 15 to 16 years, you can see, I must be visiting only one hospital after another hospital. And I used to treat these conditions only for 3 days. And then when we used to visit the patient after 45 days, we used to see how much recovery has been done. It was a wonderful recovery. Then I followed Dr. Udipong. Dr. Udipong only gives one treatment a week. He's a neurosurgeon from Thailand who practices acupuncture. And he gives only one treatment a week. And then I saw, wow, his patients recovered like anything. He classified his acupuncture techniques on the basis of dermatome, myotomes, and then I added neurotome to it. So that is what I say, integration of techniques will recover the patient. This is where my research was there. My research was very important in the sense that we replaced the Botox injection with saline injections, SNIT. I call it Sastry Neural Injection Therapy because it is the first time in the world the cost of Botox was replaced only by a saline injection. A combination of normal saline and dextrose saline, including with various tung point and NIBS, non-invasive brain stimulation, recovered the patient instantly on the table. Now can you imagine a patient who is very much paralytic can recover in 40 seconds, 50 seconds? You can bring his strength from 1 to 5. And we have done it large number of cases. Few days back I could show you, I have put up a post in WhatsApp where there was a person who was mentally retarded, which Dr. Goul and me used to say, a type of idiot person who understands nothing. And he was on the bed for 5 years. He recovered very nicely. Where? By just inserting few needles and 2 and 3 tung points. He stimulated with the pain and the patient recovered. And that is what I say, the magic of tung acupuncture is good. What are the principles? He said, muscle treats the muscle, nerve treats the nerve, bone treats the bone, organ treats the organ. So what are the 5 principles? So if you are teaching a muscle conditions like psoriasis and all, you have to insert the needle slowly. But when you are treating a pain condition of osteoarthritis, what will you do? You have to touch it with the bone. But when you are teaching a palpitation, you have to bring the needle near the nerve. That is why the anatomy knowledge and physiology knowledge was greatly used by Master Tung. So he had how many points? How many zones? It was 10 zones. So how did he mention? It mentioned as 11, 12, 13, 14. So no, it is not like that. 11. Then what are the other zones? What are the zones? Can anyone tell?
22,
22, 33, 44, 55, 66, 77, 88, 99, 10, 10.
Yes. Yes, see. How we classified? It was 11, not 12. 11, 22, 33, 44, 55, 66, 77, 88, 99, 100. That is 10. So the 11th zone was this one, the palmar side. The opposite side was 22. Then the wrist from the, what you called, wrist to the elbow.
Forearm.
Yeah, wrist to the elbow. Wrist to the elbow was 33. Then 44 comes where? 44 came
Upper
in the
arm. Elbow
upper
to
arm.
shoulder.
Yeah,
Above
it
arm.
was not, it was from trapezius to the shoulder. Then came 55. 55 was the palmar side, palm of the feet. Then the metadorsal side, that is the upper area where there is finger. And then in between the knee and the ankle, it is 77. Yeah, knee and the ankle is 77. Then in between the hip and the knee is 88.
Tie.
In between the hip and the knee is 88. 9 was the auricular zone. And 10 was the scalp. Am I clear?
Yes, sir.
Yes, sir. Forget it. Once again, I did it. Yeah. And Dr. Eli, did you understand me? Dr. Eli?
Yes.
Can you?
Yes.
He classified it into zones, not
The
meridians.
last classification, please. The last classification after the hip and the knee out. The last classification, I couldn't hear it well. Please.
Okay, I'll explain again. Right. So when he classified acupuncture into zones. What are the zones? 11, which was the palmar side. Then the opposite side is 22. Then the area between the wrist and the elbow is 33.
Yes.
Then comes from elbow to the trapezius.
55.
The upper arm.
55.
So 44. Now comes the plantar area. It was 55. Then the metatarsal area, where you can see liver 2, liver 3 and all, is what? 66.
66.
No, 66. 66. Then between the ankle and the knee, it was 77. The point zone of 66 falls between the ankle and the knee joint. From knee to the hip was 88. Then comes the auricular, 99. And then comes the scalp, 100. Then came DT and VT. DT was on the back, dorsal trunk point. And VT was the ventral trunk points on the abdominal area. Am I clear?
Yes, sir.
Then comes the principles. He said the reaction area and the reaction nerve. His treatment was followed with whenever any disciple had a doubt about the selection of the point. Master Tung never used to speak too much. He used to say, observe yourselves and realize for your understanding. He used to put a needle and then the patient used to recover, and then his disciples used to say, Master, what is the principle? What are the points? Master Tung never spoke.
No.
He always used to say, observe for yourselves and realize. And that is why he produced some of the finest physicians like Master Tung, Vichy Young and all. And most famous was Wang. Wang rather went to America and he settled there as an osteopath. And see, the most important part of Wang was that his father was very close friend of Master Tung. And so Wang got a very good chance of studying with Master Tung. He stayed with Master Tung for 13 months. It was said when he was the follower, he went to treat one president. He was invited to treat one president, and he went as a brand ambassador to Taiwan, to that particular country, and he recovered it with just 2 needles. It was 11.10. Using just 2 needles, 11.10 and 22.10, I suppose, which I will show you. He recovered a large number of patients. And one more thing I want to tell you. When Mariam Lee started acupuncture in America, there were a lot of, Mariam Lee need not have time like me when I used to treat. Now my health is not okay. But earlier I used to treat around 70, 80 patients in a day. Even my juniors, they said that we don't get time to do toilet. What I will do, sir? Now we reduce that clinical load because now our health is no more good. But in our just 2 years back before the death of my father, you could see my clinic used to have around 70, 80, 90 patients per day. The old and the new patients. Now we reduced it to how much? We reduced it to only 5 to 10 or 15 patients. But then whenever we need to do some trials, what we do? We go to various villages of Assam. Since I'm a very famous person in my place, the moment I go there, I have number of patients. And then you can see, I treat around large number of patients there. In a single day, we have to treat 200 to 300 patients. And from there, we concluded each tongue point which I treated was done on my treatment evaluation, whether it was working or not working. And that is what I say, tongue points really work. But then, tongue is not the final concept. You have to integrate it with other treatments. That is why I said today that I'm going to teach you various things together, right? So I have a habit of teaching tongue acupuncture in Bhasa language. So my translator will be Mickey. Mika, you please translate me in English.
Yes. But please don't confuse 5 and 6. 5 is lima, 6 is nam. You used to.
Okay.
Yes.
Okay. So, see, it is based on treatment protocols. Now you can see 11.01, 11.02 and 11.03. I'll speak in Bhasa language because until I speak in Bhasa, I cannot teach tongue acupuncture in my life. And I'm sorry. Because I have learned tongue acupuncture in Bhasa language. Bhasa means Indonesian Bhasa, right? And what you call Mika will translate you in English, especially the numbers.
Yes,
so what I'm going to tell you, when I'm going to speak to you about certain conditions, if you see the supply branch of the radial nerve. The reaction area is heart, small intestines, and large intestines. So this is the basis of the tongue acupuncture treatment. So you can write down the tongue, what do you call it? Protocols. So, Mika, are you ready?
Yes.
Duablast and Thicablast. Yeah. So now let us start, okay? God bless me. And with all blessings of Master Tung, we start this class. So whenever there is a acute pain in knee, palpitations and all, you can use this point. You can see the indication of this point, and then according to the area, you have to use it. You have to insert the needle to the swallow level. So it is said, sato sato sato, sato sato dua, sato sato tiga. Means 11.1, 11.2, 11.3. You can see the anatomy of the point is, it is supplied by the radial nerve. And the reaction area is heart, small intestines, and large intestines. So whenever you have a hernia pain in the hernia region, umbilical hernia and all. So what are the points you have to use? Sato sato sato, sato sato dua, sato tiga. 11.1, 11.2, sato sato sato, sato dua, sato tiga. Am I correct, Mika?
Yes. Yes.
That means
11.
11.01, 11.02, 11.03. You use three needle at a time. And you can see the knee pain, the palpitations, the umbilical pain, and even in the bronchitis. This time I have used this point very largely with PC6, Heart 7, and Lung 6, and LI11 for COVID cases. Especially, I've been teaching these points in Italy. So this is very, very effective in COVID cases because it has direct relation with this one. For any lung infection, further aid. Spleen nam and spleen nima. Spleen 6 is lima, na?
No, nam.
Yeah, spleen nam. Spleen nam and spleen samilan. Means spleen 6 and spleen 9. For what?
Yeah.
Sato sato sato, sato sato dua, sato sato tiga. Plus SP6 and SP9. SP nam, SP samilan. It is used for what? Bronchitis, whoopingness. (11.01, 02, 03). Further add SP6, SP9. Now you have anxiety neurosis. You are having serious palpitation because of TSH problems also. What are you going to do? Use sato sato sato, sato sato dua, sato sato tiga with PC6, Heart 7, PC6, Heart 7. You are treating with liver 3. 11.01, 11.02, 11.03. You can see the locations which I will show you of 11.01, 02, and 03. Immediately, your tachycardia will subside. Now you are having typical fluctuation in the blood pressure because of your anxiety. And you are feeling a lot of weakness. What will you do? So write down, especially in fatigue syndrome, for which liver in TCM diagnosis, for which stagnation of the liver is important. So write down the formula.
What syndrome again, sir?
CFS, chronic fatigue syndrome.
CFS. Okay. Thank you.
Write down. Sato 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 blast. Sato sato dua blast. No, sato sato 1 minute. Yeah. Sato blast.
Satu.
Lawan blast. Yes, sato. No. 1 minute. Let me 1 minute. Yeah. Sorry. Sato dua, sato tiga. Right. 11.01, 11.02, 11.03. These 3 points. This is called inserting 3 needles in a similar zone is called dauma. So 11.01, 11.02, 11.03. Satu 2, satu 3. These 3 points are same, right? Then add for what problem I was saying you?
Chronic
Fluctuation of the blood
Yes.
pressure, especially in the fatigue chronic syndrome.
A chronic fatigue syndrome, yes. So add further laban tujo blast, laban blast, laban samilan blast. That is 88.17, 88.18, 88.19. Further add. You will have to add 11.01, 02, 03. Put these 3 needles. Then add plus 88.18, 17, 18 and 19, which you will see later on. Please write down the formulas. 11.01, 11.02, 11.03 plus 88.
17, 18, 19.
Laban blast, laban samilan blast. That means 88.17, 88.18, 88.19. Further add. Then add what? PC6 and heart 7. SP6, SP9. After inserting the needle, put moksha on kidney 1 and SP9 and SP6. Within few days, you will see the patient recovers in a very good way.
Moxa in kidney 1 and also in spleen 6 and 9?
SP6, SP9. Yes.
Okay.
Now you would like to ask me, sir, how many minutes the needle has to be inserted? As per Tung principles, this needle has to be inserted by what? For 45 minutes. 1 clock cycle is for 45 minutes. How many minutes? 45 minutes. Because the reaction takes in how many minutes? 45 minutes.
Saya ambil kira dapat
The reaction takes place in how many minutes? 45 minutes. So 1 clock cycle is of how many? Yes, 1 clock cycle is of 45 minutes. So you have to put the needle for 45 minutes and then you have to rotate the needle. You have to twist the needle very slowly for how many minutes? Till he says, ah. So in every twisting, it should be for three times. So once he says, ah, remove it. Then again twist it. Ah, remove it. 3 times. Ah, patient will feel better. Take another formula for whooping cough. Sometimes you will see a lot of whoopingness is there. So what are the formula? Right. Satu satu satu, satu satu dua, satu satu tiga.
Excuse me, sir. This is for what?
Whooping cough.
Batuk rejan.
Apa itu?
Batuk rejan.
11.01, 02, 03. Sorry, I forgot to translate in English. 11.01, 02 and 03. with which problem was I saying? Which problem?
Whooping cough.
Whooping cough.
Cough.
Huh?
Whooping cough.
Whooping cough.
Ah, yes. And then spleen channel. You have to put the needle on the tender points of the spleen channel. Spleen channel. Where? Below the knee to the ankle. You have to follow, you have to palpitate the spleen channel. And then wherever you find the tender points, you mark the tender points, that is RC points in the channel, and then insert the needle there. And after some time, you will see the whooping cough reduces. And then tilt the patient into 60 degree. You'll feel much better. Then we nebulize the patient, then we give Lasix, patient feel much better. But before doing all this, be careful. You must know that you have to see the electrolytes and everything you have to check of the patient. But then, being acupuncturist, you can use this. So here you can see 11.02. And here you can see 11.03. Now, right. Satu satu satu, satu satu dua, satu satu tiga. It's 11.1, 11.2, 11.3. With PC6, LI11, PC NAM, NIMA. It's NAM, sorry, PC NAM. PC6 is PC NAM. And LI11 means large intestine satoblast.
Sebelas.
Sablast. LI11, PC6. 11.1, 11.2, 11.3 with PC6 and LI11. Include stomach 30. 1 minute. Include stomach 36 and SP6. Yes. अरे हम तुमको स्लाद के लिए बोलना भूल गया था क्या? है क्या स्लाद? तुम उसको ना गोल गोल काट के दे दो. नहीं, तुम कीमा बनाने से थोड़ा सा देता, हमारा नहीं चलता है. तुम 3 टू प्याज काट दो, 2 प्याज काट दो, 2 टमाटर काट दे देना. हाँ. Sorry, I was giving my food order. I was in the hotel.
Sir, what syndrome is this for, please?
Gastroenteritis, gastro pain, gastric
Okay.
pain.
Thank you.
Right. Satu 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 dua satu satu tiga. It's 11.01, 11.02, 11.03. With
11, P6, stomach 36, SP6.
that is finished, madam. Gastroenteritis. Now write to take. You will write for to take. So what is this? 11.01, 11.02, 11.03. With stomach 7. Stomach 7. And wait a minute. Stomach 7. 8 stomach 7. And Yavartika. I think it recovers the pain. I did it. Stomach 7 and Yavartika. Yes. Get LI4. So here you can see interesting thing. 11.1 is here, 11.2 is here, 11.3 is here, right? And 11.4 point comes below 11.3. So this is 3, and just below it here is 11.4. Did you understand me?
Yes.
Yes.
See, this is
Yes.
this is 11.1, this is 11.2, this is 11.3, and below 11.3 is 11.2. 11.4, sorry. But generally when we use 11.3, 1, 2 and 3, it's enough. So I did not mention it about 11.4.
I'm sorry, sir. I didn't notice how to read the 1102, 1103. What is the difference? Because the point is so close.
See, this is the Tung points. They are close means what? Even if my one district is close, my Guwahati is close to Nalbari, another district. The culture changes.
Okay. See,
The indication, see, the question is that does not mean for the anatomy and physiology of the. To understand this, you must go more deeper in anatomy and physiology of the fingers. Did you study the anatomy and physiology of the finger joints? Fingers? Did you study the
yes,
nerve pathway? Did you study the reaction
yeah.
nerve? Did you study that? You studied?
The location of the nerve in the finger,
Yes, yeah. So
the
what is the
anatomy.
location of the nerve? Yeah,
Yeah,
what is the
on the
location of this
side,
nerve? What is the,
on
yeah,
the
what is the location of the nerve?
at the
Which
lateral
nerve
of
passes by
the
this area? Which nerve?
in the side.
Which nerve? Name of the nerve?
Oh,
Ulnar.
what's the nerve?
Name of the nerve is what? Huh? See, it is supplied by the branch of the radial nerve. And that is why I say, when I take the class, please hear me.
Radial
That,
nerve.
yes, it is supplied by the radial nerve. And then what? I said you, it is called the dauma. When you have to put the needle, you have to put on the same line.
Okay.
Then only this reaction area will take place. Lung, heart, and six bowel. If you use this dauma needling, then only the reaction area will take place. So you can see 0.5 Fen needle, needling down one Fen treats the heart organ. So when you put this heart organ, you will see the pain in the knee goes down. So when you speak about umbilical hernia, it does not mean that it has recovered umbilical hernia. It is an anti-inflammatory property. That is, it reduces the pain of umbilical hernia. The moment you put the needle in 11.01, 02, 03 with SP6 and SP9, you will see the pain in the umbilical hernia. Ah, beta. Yes. Thank you. नमक दिया बेटा? नमक एक्स्ट्रा से दिया है? Oh, lovely, मेरा child. नींबू नहीं लाया आज? Thank you. So when you are spitting in bronchitis, you will see there is a type of yellow phalgum. The phalgum comes in various colors. You will see white, sometimes you will see yellow, sometimes you will see green. So when there is a yellow phalgum, what will you do? Write down. 11.01, 11.02, 11.03. 111, 112, 113. With 111 now means 11.05. So once you put this, what will happen? The reaction area is what? The lung, the heart, and the six bowels.
And what lung, heart, and
6 bowels.
6 power. Okay.
6 bowels means 6 food organs.
Okay.
Excuse me, sir. Is it 116 atau 115?
Yeah, 112, see 111, 112, 113 means 11.01, 11.02, 11.0.
He means 11.05.
Copy, you copy.
11.06.
05, Nam, 11.05, not 6.
No, 5 is 5.
Oh, sorry, 5, 11.05, sorry. Rima. 11.05, thank you. I always so it is 11.01, 02, 03 plus 11.05. Once you practice on patient 2, 3 patients, if you practice, the points will automatically go inside your hand. Because 1 or 2 needles here and there, topic over. For what part I was saying you? Which disease? Or splitting a locum, yes. So it will be lung 9, lung 6, spleen 9.
So the additional point is LU9, SP6, and SP9.
Yes, you are right. SP6,
Okay.
SP9.
This one is for lung problem, heart, and 6 power. Okay.
And then when you spit, you will see yellow color.
Oh, speak. We see the yellow color.
Yeah. The phalgum is of yellow color. Dr. Eli, are you there or you have gone? Dr. Eli? Dr. Eli, are you there? I think it's gone.
Yes, sir.
Dr. Eli has gone. Maybe internet disconnected. Always remember one thing here. Simultaneous needling is prohibited. You cannot needle in both the sides. So this is 3. When you use the Dauma needling, guess what? If you add 1 teaspoon of sugar, whether your tea will become sweet? No. So how much sugar you have to use for 3 cups of tea? 3 teaspoons, right or wrong?
Yes, sir.
To have a reaction, you have to have a sweetness of your tea. Do you give 1 pinch of salt or the required amount of salt? The required amount. So this required amount is called the Dauma. Am I clear?
Yes.
I rather made it simple for you. Otherwise, I wanted to include NIBS, not now. I let NIBS later on because your location of your brain is not clear to you. Now right, 11.06 and 11.07 comes in the same area. Dauma of 11.06, 11.07. Or you can write one more thing. You can write 11 point. Write down 11 point. Sato Sato Nam Sato Sato Ima 11.05 and 11.06. So when there is a very acute pain in the hernia, I given the point for that. Before this, what point I gave?
11.01, 11.02, 11.03, SP6 and SP9.
For what purpose?
Hernia.
Hernia and ED 11.5.
Can you please repeat for the hernia?
Yeah, right. Sato 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 Dua Sato Sato Tiga means 11.01, 02, 03. With 11.5. Zhongjian. Yojian, Zhongjian.
Can it still be used to inguinal hernia?
Yeah, it is for inguinal hernia and umbilical hernia, acute pain.
Thank you.
But then you have to see when this point you have inserted and the pain is not reduced, then you have to examine some spider veins in the lower limbs.
Okay, doc.
So when you examine the spider veins of greenish color, you just bleed it and the pain will subside.
Thanks.
Correct?
Thank you, doc.
Right. The combination of (11.06) and 11.07. So some people was asking me, say if there is a costochondral pain and some skin infection, you can see this type of skin infection, you can see. This point is very good, but diet restriction is important. 11.07. So 11.07 ideally is a 3-point location. So this is a 3-point zone, right? You have to insert 3 points here for dermatosis and palpitation.
Is there any distance between these points, sir? I mean, what is should be the distance
Huh?
between these? What should be the distance between these points? It is next to each other.
Yeah, it is next to each other. You see?
Second phalange, right? Second phalange.
Yes, you see? I mentioned this here, see? So we are very happy to say one more thing. All these programs will be added to what? Modules, right? So these modules will be awarded certificate with in collaboration with Acupain Care and Lincoln University. Right? Acupain Care and yes, Lincoln University College. So that when you take MSc course, all these hours can be included somewhere. Correct?
Yes, sir.
Remember one thing, LAMP was the institute, so we were finding some trouble. An MSc course was not sure at that very moment of my time. So we took one stopgap arrangement. Now we can put all this course in modules. Module 1, Module 2, Module 3, Module 4. So Tung acupuncture becomes very much part of what? Of what? Medical acupuncture. So we completed today. You may ask me your questions. You may ask me your questions.
Sir, one question. Hello.
Yes, tell me.
Sir, we have to use the acupuncture needle or the Sujuk needles also will do?
In a Pama side, you can use the Sujok needles. But when you use the 76, 55, 66, 67, 44, you need the acupuncture needle. So practice better with the acupuncture needles.
Okay. And sir, in case if we do not have the needles, can we use the magnets? Will it be effective?
I doubt.
Okay, okay, sir. Thank you.
Only needles will give best results from experience.
Next question, please.
Sir, any one side we can put the needle, sir?
No, it is always the opposite side. Frequency of treatment has to be decided. This is a question put up by Gina del Cruz. See, now the question is that you cannot decide the frequency of the treatment on the one go. It has to be seen what is the condition of the patient. Ramakashi, Sheshe. Thank you so much.
I used this needles. I used these points with one patient with left inguinal hernia and got a result. The weekly twice treatment is required.
Say question. One thing I want to tell you. 1 minute. One thing I want to tell you. Inguinal hernia does not meet the condition of hernia. It only speaks about the painful relief. You are relieving the pain, nothing more than that.
As you said, it is maybe due to inflammation of the intestine. Actually, it was true.
See,
And I
one thing.
treated
No,
the
Siddheshwar, no. I'm not saying anything else. I'm just saying that it cannot treat inguinal hernia. It treats the indications and pain of inguinal hernia. Topic over. Right? It cannot treat any associate conditions. It treats the pain of inguinal hernia.
Or hernia may be due to inflammation or
So,
prolapse.
No.
No audio, sir.
See, when we speak about the inguinal hernia, we do not treat it with the pain. We treat the pain associated symptom. The patient is suffering from acute pain. So it's an emergency treatment. But all this we have done practically. So whatever I am teaching you is practical treatment. It's very effective, instant recovery, and quickest recovery.
Yes, sir.
More questions?
True, sir.
Doc MK,
Yes, please tell me.
for inguinal hernia, so since you said that it cannot treat, it can only relieve the pain, does this mean that we need to undergo operation for this inguinal hernia to be treated?
Yes. They are 100% correct. You have to treat the inguinal hernia with the surgery and you have to put the net.
Okay.
It's a surgical condition. It cannot be treated by any other means.
Okay, thank you, Doc.
It cannot be treated by medicine. It cannot be treated by acupuncture. It cannot be treated by any other method. So to the best of my knowledge.
Okay, Doc. I have to prepare for my daughter. My daughter has an inguinal hernia.
So better prepare a surgery and recover her. Because afterwards, the umbilical will come outside or something will become more complicated. It's better to recover the person at this initial stage than to aggravate and recover the patient.
Okay. Thank you, Doc.
More questions, please.
Excuse me, sir.
Yes, tell me.
No, sir. What about epigastric hernia? Epigastric hernia.
See, I have not worked with epigastric hernia and tongue acupuncture, so I cannot say about
Thank you, sir. Thank you, sir.
More questions?
Hi, sir.
Okay.
Sir, are Arvin here?
Who?
Arvin, sir. Arvin.
Who is speaking?
Arvin, sir.
Arvin, tell me
From
what is the
Philippines.
question? Yes, tell me,
Um,
Arvin.
can we combine the technique of TCM acupuncture and also the tongues technique?
No. What you want to combine?
The TCM practice or the traditional technique of answer together with the tongues. What you taught us today or tonight. Can we combine it with the one who in
Can you give me one?
the TCM?
Okay. Now, can you give me an example? What you want to treat with tongue and what you want to treat with TCM, and where you want to combine it? You can use the TCM points, right? But then, can you give me an example
Yes,
of
sir.
a disease? What you want to do that?
Actually, sir, I have a patient, for example, for facial paralysis, and then I applied some points for the facial acupuncture and also what do you call it? For
No, okay.
for heart and
One minute. Can I ask you one counter question?
okay, sir.
What is the syndrome of facial paralysis in TCM?
Again, sir.
Syndrome analysis.
Syndrome analysis.
Yes.
Sure, sir.
So one thing I tell you, in TCM, in NIBS, if you don't know if you are speaking TCM and you don't know what is syndrome analysis, you don't know TCM.
Okay, sir. Sir,
Syndrome means
actually,
the pattern of
I'm
the disease.
reviewing the.
Yes, what you are reviewing, you have been not taught this. TCM means syndrome
Yes, sir, yes, sir.
analysis. Syndrome means what? You must understand by various means of diagnosis what is deficient where and what is the disease, how it, what has happened inside the body. Because you must understand the wind is in Taiyang, Shaoyang, Yangming. Write down the names of the channels. Taiyang, Shaoyang, Yangming. Taiyin, Shaoyin, Chuyin. Taiyang, Shaoyang, Yangming.
Okay, sir.
Taiyin, Shaoyin, Juyin.
Okay, sir.
Right? So, I'll give you one, those who know acupuncture, they can use these formulas.
Thank you, sir.
One minute. So, what is Taiyang?
Lung. Taiyang free.
What is Taiyang? Arvind, what is Taiyang? Which are the organs in Taiyang?
UB and SI.
I'm not asking anyone. I'm asking him. What are the organs? What are the involved in Taiyang? Write down. SI and UB. Small intestines and UB. Write down. Arvind, can you hear me?
Yes, sir. Yes, sir. I can hear you,
Yeah,
sir.
right. Yeah, the Taiyang is small intestines and UB.
And you, yes, sir.
So whenever you see there is acute pain in the sciatica nerve, and sometimes you do not know what to do it. You know the SI channel? Yes. So go to the SI channel, palpitate the most tender points. Palpitate the most tender points of the SI channel, right? You go to the SI channel and you go like this, like this, like this, like this, like this, and you'll find the RC points. So in these RC points, insert the needle.
Okay, sir.
Do it like this, twist it. What will happen? Your pain will subside. It's a pain relief. It's not a pain recovery. But it gives an immediate relief on the pain. Then Taiyang. Then comes what? Shaoyang. Write down Shaoyang. Triple warmer and gallbladder. Yeah. Triple warmer and gallbladder.
Gallbladder.
Yangming.
Okay, sir.
Large intestines and stomach.
Okay, sir.
So
Okay.
young men, large intestine and stomach.
Yangming is large intestine and stomach. Shaoyang is triple warmer and gallbladder. Large intestine is, large intestine and stomach is Yangming.
Yeah.
So whenever there is a pain in the large intestines, in the cervical spondylitis, you can use what? The stomach channel. Palpitate the stomach channel. You will see some points, tender points. If it is in the limb, see the foot. Palpitate the channel. Just press it with your thumb. You will see some RC points. Insert the needle, topic over. Pain will subside. So, the principle of I Ching is yang treats the yang, yin treats the yin. So these organs are what? Taiyang, Shaoyang, Yang Min. So these are yang. So yang treats the yang, yin treats the yin. So Taiyin, Shaoyin, Juyin. So write down Taiyin. Lung and spleen. That is why I said whenever there is a problem in the lungs, you can use it with the spleen channel. Can you hear me?
Yes, sir. Yes, sir.
Loud and clear, sir.
Then comes the Shaoyin. Heart and kidney. Then comes Juin, pericardium and liver. Correct? So each organ treats the other organ. Thine is liver and spleen, lung and spleen, Shaun is heart and kidney, and Join is pericardium and liver.
Heart and kidney. Yes, sir.
So what is the principle of I Ching? Yang treats the yang, yin treats the yin. The principle of Taiyang. So leg Taiyang treats the hand Taiyang. Foot Shaoyang treats the leg Shaoyang. And Yang Min treats the Juyin. It's from the I Ching. So whenever there is a problem in the pain of one channel, you may treat the other channel. And this is the 10 principle one. Yang, yin. The principle number one of 10 balance method. Yang treats the yang, yin treats the yin. So whenever there is a bladder pain, treat it with the SI. This is the principle number one. Yang treats the yang, yin treats the yin. Topic over. So on various locations, you will see Tung was inspired by 10. Correct? More questions? Can you hear me?
Yes, sir.
Yes, sir.
Can you hear me?
Yes, sir. Yes.
Yes, sir.
Achha, now I want to ask you one small question before I leave. How many people are here from the neuroscience department? How many people are here from the neuroscience department? See, such a problematic people you all are. You create so many problems for us. Yesterday, one of your doctor told me, I'm saying, one of the doctor from your Philippines is giving me a gay video. And one of your doctor from Philippines is giving me what? A comment that I'm a gay. You imagine. I'm asking you an expression. How do you react? The reaction takes from the chemical impulse and the action potential. I said it is the same reaction which takes place while you are driving the car, you are learning acupuncture, or you are opening your clothes. It's the same reaction which takes place. It's a series. It is the same series which will take place between what called the recovery of the muscles. If you choose a wrong muscle and give you a wrong stimulations, what will happen? The patient will walk for his whole life in a wrong way. I don't understand what kind of people you are. Really, it offends me. That is why it is very difficult to teach you neuroscience. Sometimes we become so offended. You are saying clinical discussion. For all these years, I taught you motor cortex. Now, what is the utility of motor cortex and central sulcus and all? Running anatomy will recover the patient or what? No, you have to recover the patient by a proper method. I don't understand when you will become matured. And that is why you don't understand anything. Because you don't take the initiative to understand. You don't have the patience to spend half an hour extra and learn the things. And as a result, what you will do? You'll go and make mistakes in your clinic. And then you will say, oh, I cannot recover a patient. How can you recover a patient? To recover a patient, your concept should be clear. Not a single concept is clear in you people. You do not know what is syndrome analysis. When I ask you about TCM, you do not know the principles of TCM. When I ask you about uh, basis of your treatment, I do not know. I know only the points which has been memorized. I don't know. Anyway, I'm not saying about any particular person, but then please stop all these activities. In India, one thing I tell you very clearly, we are Dikshit people. Dikshit means what? We are not supposed to indulge in any sexual activity with any person in our whole life. We follow ISKCON and this one. We are like the Christian nuns. We cannot have any physical relationship with anyone. Even thinking of that is a wrong for us. For our entire life, we are supposed to spend with what? Our devotion in books and all. That is why we are called Sastry. When you don't know about any culture, you should not say that. Even in ISKCON temples where we stay, girls are not allowed in our room. Even in my rooms, girls are not allowed. If you don't come with 10 or 20 people, if you want to meet me in my room, you have to come with a group, 5, 6, 7, 8, 9 people. No single female is allowed in my room. And these are the principles which I have learned in Malaysia. We have to respect these cultures. Indonesian culture, it's a beautiful culture. I don't know what you made what to you. Why you all have become like this. It really offends me. That I'm trying to teach you the recovery of the muscles in paralysis. And you people created a havoc of it. Someone is sending me a gay video. Someone is saying me I'm a gay. And this Dr. Hector has told this all nonsense that I'm a gay. I don't understand what do you mean by this. I'm interested in the balls. I'm a doctor. I'm working in the serious conditions of the medical. Are we interested in all these quankary things? Arvind is just like my kid. Can you hear me?
Yes, sir.
Yes, sir.
Arvind is just like my kid. He's like my student. I'm like his father. Why should I think all this? I just was asking what is his expression. And from this expression, you can understand how to interpret the brain signals, the motor deficiencies. It is the same signal which you provide while you work in neuroplasticity. But then you don't know, seeing a medical doctor bloody. What kind of medical doctor you all are? When you don't know the principles of recovery, when you do not know anything. Just taking a certificate do not make you a medical doctor. You may be a good cardiologist, you may be a good neurologist, but when you come to the neuroscience, you must know a lot of things inside. You must know the neuroendocrine pattern, you must know the deficiencies of the brain. Can you hear me?
Sir, I can hear you, sir.
Others?
Yes, sir.
Yes, sir.
I can hear you.
Yes, sir.
Yes, sir.
You know, that is the problem. Why no one wants to teach you? And why people wanted to teach you only with a lot of money? It really injures us. They are taking so much time after preparing your slides and they are trying to make a very complicated topic to make you understand in just 2 lectures that how the brain reacts with the needles, how the muscles react with the needle, how to recover a paralytic patient. No one will teach you in the world. No one knows these patterns. Because I have treated the patient from United States of America to the Italy, to France, to Germany, to Australia. We are practical people, we are physicians, we are doctors. It is not necessary for me to write down the word doctor against my name. Why should I write? When I don't practice medicine, because a lot of doctors are practicing medicines, why should I practice medicine? In the hospital, I am the only physician. who works in rehabilitative care like this with the use of NIBS needling. In India, I am the only person. So why should I go with conservative treatment? There are 200 conservative. And wherever necessary, I can prescribe the medicine. Why I need to say that? Really, I'm really sorry to see your mentality of a senior doctors talking nonsense. It seems that they have never studied medical science. And if they are so knowledgeable, why don't they teach you the topics, critical topics of what neuroscience and all, how to recover paralysis patients, how to recover the critical cases, which are the muscles you have to touch first. We have learned it by after treating how many patients? We have learned it by 500,000 patients we have treated. I was really amazed to see that how cheap mentality doctors they are. And better never to attend them. If they have such mentality, please don't come to my class. Because you are doctors. You must maintain, mind should be clean. Patients are suffering. I don't know in what politics you are involved. Can you hear me?
Yes, sir, we can
Yes,
hear
sir.
you.
Yes,
Sir.
sir.
Hello?
Yes, sir.
Yes.
Yes, sir, we can hear you, sir.
Yeah, we hear you.
And you
I
should
can hear
expect
you, sir.
things like this, sir. Okay, as you go along, I'm sure you've heard this, and it will come always, sir. You're doing something that is revolutionary, so you would expect people to challenge you in every step of the way. You're teaching people to recover patients at a very, very cheap price. So people who are making money from the same thing that is not as valid as yours or valuable as yours would not welcome you into their realm. They would always challenge you. You recover a paralysis patient in under $50. $50 because you feel like even charging money. How much is a pack of needles? And somebody else would charge a couple of $1,000s for the same thing. He wouldn't find you a friend. He would always challenge you. He would do whatever he or she can do to stop you from doing what you're doing because you're fighting them, or they see you as fighting them. They do not see you as trying to make it easy for them. They are not ready to learn to recover the patient and the patient goes away. They want a patient that will be maintained on their hospital list, that would come in every week or every month to get some sets of drugs for a review, and he goes, and so they have a permanent income. You, sir, on the other hand, are training people to do things that are contrary to that. So you would expect at every time that you will be challenged, sir. You would expect at every time people will try to throw stones and to get you angry. In fact, I am sure people would celebrate and throw a party were you to say you were not teaching anymore, because that is their intention and we cannot let them win. I don't believe you are in
Yeah,
class.
I say, no.
So, sir, let us just
See, one thing I
they're empty barrels, sir, and empty barrels make the most noise. We all know that. So let us
see, one thing I tell you, no, one thing I tell you, Violet, I must be very clear about my principles when I take the class.
We know your principles, sir, and your students know that. The people who throw stones or try to make things or say things know that, and that is why they say that to try to annoy you, to try to push you to an edge or to make you react. And we're beyond them, sir. They can do whatever they like. They would not stop us from learning, and they would not stop you from teaching people how to recover people at a very efficient and cost-effective means. So you're always going to face
the question before one minute thing, 1 minute, Walid. One thing I want to tell you: people are suffering in the bed. When I went to Philippines, I saw people are paralytic from 10 years, 15 years. But when they needle, they recovered in 2 seconds, 5 seconds, 10 seconds, and they continue to recover.
Yes, sir.
I don't understand. What makes us so cheap? after getting so good medical knowledge.
Agreed, sir. What you have done is you have freed the people from the bed at a very cheap price. The other people have kept them on the bed to milk them and make money. So there is greed, there is a lack of empathy and a lack of compassion. We see this everywhere, sir. So that challenge will come to you. Every day people are going to fight you. I believe I'm talking on behalf of everybody in the class, sir. And unfortunately, your network is going in and out. But I believe this is where it's all at. We face challenges like that once you bring out a revolution, something that is new, something that is going
Yeah, I'm not. I have nothing to worry about anything.
Ignore,
don't
ignore
worry, sir.
them, sir.
See,
Ignore
one thing
them.
I want to tell you. Can you
Ignore
hear
them,
me?
sir. Yes, sir, we're
Yeah,
hearing.
yeah. Okay.
See, one thing we must be very clear when we are sitting in the class. We are not sitting here in the class for myself or yourself. We are sitting in the class because people are suffering.
That
They
is
cannot be recovered in the hospital. They are not having any chances of recovery, so they are coming to us. And it is our prime responsibility and duty to support them.
that is true, sir. And that is why we're all here
It's
to
not
learn.
a time for us to enjoy. I don't have. One thing I tell you. One thing I want to make it very much clear to Filipinos and other people. I am a very busy person.
That
I'm associated right.
Ignore them, sir. Ignore them.
Your poor
You
network.
have to ignore
Don't
them.
worry about them, sir. It is just a bunch of yahoos or AX making noise, and that's the most they can do. It's the only thing they can do anyway. And inshallah, we will learn, and inshallah, we will help, and we will recover people. So
See, the question is very simple. So the question is very simple. When I go to you, come to me, your theory should be so clear that you can understand practical in 1 minute.
yes,
Can
sir.
you hear me?
Yes, sir.
Yes, sir. Yes, sir.
See, in medical science, one thing you must know, there is nothing called theory. Everything is practical.
Practical, yes, sir.
I don't know where. Yes.
We're with you, sir. The network is a bit up and up. I don't know if you're still on, sir. Are you there, sir?
Some misunderstandings among the participants leads to the set of problems. Mr. Walid is right. You proceed your mission, sir. You are on the right path for guiding us in all areas. Thank you, sir.
Hello, sir. Yes, doctor. It's the situation.
Yes, thank you, Mr. Walid. You are spoken to
Yes.
Mr. Sastry on behalf of us to share your view.
See,
What you said
no,
was
see,
very correct and accurate.
See, the question, one thing I want to tell you, I am a matured physician. I work in 20 hospitals. Perhaps I don't think any one of you will work in a month in 20 hospitals or 15, 18 hospitals. You won't be working with 600 physicians. I work with how many colleagues? I have 500 to 600 doctors I work with. More than that.
Sir, don't mind them.
One minute.
Old men with gray hair coming to learn from him because they want to recover patients. Only Sastry has people around the world wanting to learn just because people are suffering. We're here with you. So leave them alone, sir. Forget them. They're empty barrels. You know when you
No. See. 1 minute, Walid.
Yes, sir.
I must clarify everything. See, one thing I must tell you. I am by principles, I follow the strong principles of Islam, Christianity, and Hinduism.
Yes,
right?
I know that.
And as per my Islam principles, I'm not supposed, once I said, I'll follow the path of Allah and I'll never get married. I never got, and I'll never do it. Because of, whenever my father, even in the deathbed, my father was saying, you get married. What did I say? Which is more important, the patients, the people's life, or M.K. Sastry? I really feel very bad. And I was supposed to express my protest because the question is that I am teaching you a neuroscience. You must understand the feelings and the neurotransmitters. That is what I was understanding to tell you. This is how you must understand how limbic cortex performs, how reptilian mind performs. You are not performing by yourself. You are training your neurons, and then the neurons react with this.
That is true, sir. So you see, when people like that come, sir, like you said, what is use of the certificate? There are a lot of people who we call educated illiterates. They have all the certificates, but they're illiterate. Their IQ is very low. Their sense of understanding and perceivement is very low. Their sense of reasoning, it's low. So they have sense without sensibility. So you don't.
You see, one thing, no. One thing I want to tell you.
All right.
One more thing. 1 minute. 1 minute.
Yes,
No. One more thing. Do you think I am a fool to speak all these things in a class?
No. I know you're not. I understand where you're going, and I know what you're talking about, and I understand what you're trying to impart to
See,
us.
my only expression was that people make a mistake in selecting the treatment of muscles.
True.
See, when you insert a needle here, people treat first the gluteus muscles. And what did I say? You cannot treat the gluteus first. Yes. You cannot treat the facial muscle first. If the patient is having facial paralysis, is having hemiparalysis, is having like this, you cannot treat it first. You cannot treat the gluteus first. You cannot treat the upper limb first. That's all I wanted to say. Why you should not do it? I said you this. One thing I must to tell you very clearly about my life, and very clearly, I never had the numbers of any one of you people. Only recently I stored the Walid's number. I don't have time to talk. There is so much work pending here, so much files here. Because when we go to clinic, we have given 20 files to study. We have to study these 20 files. We have to prepare your notes. We have to work with the research papers. We have to moderate examination papers. We get a lot of research papers to edit. People are doing PhDs under us. So for us, all these things are not in our mind. Arvind, this, Krajya, all these things are just a small bit of fun in the class to make the class lighter. That's it. So those who want to go with this ugly thoughts, let them be ugly. Don't come to my class.
No worries.
And that is why I resigned from. That is why I resigned from this lamp school. There are so many politics here. I don't involve in politics.
That is true.
I don't have any politics. I have no politics in my mind. My only thing is that just learn, go, practice, recover your patients properly, let them enjoy your life. You enjoy your life. I have nothing to do with your personal life. See, we are doctors. We are matured physicians. I have practiced for how many years? I practiced for 30 years of my life. And I am the physician of whom? The Deputy Prime Minister of India. Now you can understand, to treat a Deputy Prime Minister of India, you need 36 clearance. It's the Home Minister of India, most powerful person, Amit Shah. I need 36 intelligence clearance before going to treat him. I have to be cleared by the state police, state CID department, CBI department, intelligence department, road department. And then I'm continuously monitored by these people also. Wherever I go, they have all my details. So one thing I tell you, we are honest people, we are Indians. You do not know, perhaps most of the Filipinos, they do not know the Indian culture. We Indians are very religious. We always take our students as our children. We never harm them. We never want to injure them. They are just our children, small kids. What will I do with the kids? But then I just wanted to explain you the ego of the muscles. That is a very important concept which I studied in one research paper. How brain reacts with different muscles. When you don't know about paralysis, when you do not know the recovery of paralysis, you should not shout in the class. You should not say this and that. Because see, the question is that you have to recover patient in below 1 minute. The target is stopwatch of 1 minute. That is the biggest research.
Well,
And in doing this, we must go with the highest principles of medical science and neuroscience. And if our mind is always with this, what you call genital area, this area, ethics, go and home and just bury your head in this one. Don't come to my class. Because in my class, you are a physician, and a physician mind is always clear from all types of this. Sex is with your wife and your boys in the room, not in the class. I only want to express, did I ask Arvind to open his clothes? Did I ask him to open his clothes in the Zoom? Did I say anything? I only say, what is your feeling? If I say you this, how will you react? And then when he gave his genuine reaction, I said, this is the definition of recovery. These are the stages of recovery. When you insert and stimulate the gluteus muscle, if the gluteus is 1 and you put power on gluteus on the first level, what will happen? He will never recover. The coordination will never be established with the brain. This is a simple principle I wanted to teach you. I told you again and again, but then people are always busy. They run away in the class. They just attend for 2 hours. When the clinical discussion comes, they run away. And that is the reason they don't learn anything. Raja is just like my daughter. How can I think nonsense about her? I make fun with her, just like a father-daughter relationship. In India, one thing I want to tell you very clearly, we as teachers take our students, whoever it is, just our children. Even in our dreams, we cannot think of harming you. Because if we do like this, we do a sin. And our society will not accept us. My society will not accept me, at least in India. They will say, Sastry is a wrong person. And one thing I want to tell you, today also I teach how many students, 1100 students in different Zoom classes. I'm a senior professor. But then we never use all this, where I'm teaching, what I'm doing. All this is meaningless in life. What is only meaningful is what? Your knowledge and your recovery of the patient. Topic over.
It's okay,
The
sir.
recovery is always, one thing I want to tell every one of you before I leave the class. Always think broad and beautiful. Then you will understand medical science. Medical science is the most toughest subject of the world and yet the easiest subject. When the principles are clear, you see, Tung Acupuncture is so clear to me with medical science. I can give you, even in my sleep, you can ask me, sir, what is the point? Or put this point and the patient will recover. But before coming to this, why did I come to here? Because Tung is not perfect. You have to integrate with TCM, you have to integrate with this, you have to integrate with this. And that is why I say you have to take support of nutrition, you have to take support of neurotransmitters, you have to take support from brain. See, my question is very simple. People are suffering. I saw Filipinos are suffering. That is why I'm teaching you. Otherwise, what is my problem? I'll just test you out from the classroom. I can teach anywhere in the world. I have 16 countries in the world to teach. Why should I go to Philippines? How many days I can stay in Philippines in my whole year? Maximum 10 years or 12 days. But in that, you cannot complete all the syllabus. It's a very big concept. Neuron to neuron communication, neuron to faulty neuron communications. It's a complete change inside the brain, I said. You must understand this. You must be matured, you must support, you must bring a new renaissance in the subjects. People are suffering. That's it. And anyway, if I have hurt anyone, Arvind or anyone, I have no interest to see the balls of Arvind because we always see in our OT rooms. We are fed up of all this. Because for us, we see 20 cases. Now, because of lockdown, our patient has reduced it. Otherwise, in our OT room, everyone is naked.
Yes,
And not only me, my sisters also say they make everyone naked. In OT room, you cannot enter with the clothes. You have only one gown, and when you go on the table, that gown is also removed. You are
people
totally
who are
nude
not
in the
used to
OT room.
that will always think you are talking about something else. But now you see somebody who is used to it, he'll be wondering, what are these people talking about? And that's why I told you, sir, just forget about them because they don't know.
Yes, that is no. One thing I want to tell you, I am a physician and I work in a OT room. In OT room, we see all the balls and all. For us, all this is a normal thing.
I agree with that, sir.
Part of the body, that's all.
It's a part of the body, just like your nose. This is one part.
That is it, sir. So
I don't know. I think those doctors don't know anything about the body and they run after gay sexuality, this sexuality, rather than recovery of the patient. I think many doctors, and I don't know, people have started sending me videos of gay sexuality and all. I said, what nonsense are you doing?
sir, maybe we'll use that for a research paper to see
They're so
what is
bad.
firing up wrong in their brains. You see, sir, a lot of people didn't realize and understand what you were trying to do. And the ego of the brain, relationship between the brain and the body, is a lot parts of it is hardwired already into the body right from, it's like a pre-programmed thing. So you find a young girl of 5 years old, if she was in school and her classmate was playing with her and he touched her bottom, even in play, it becomes a problem. She immediately goes to report him that he touched my bottom. She doesn't know why, she doesn't understand anything, but because the brain and the ego has signified to her, this is a wrong, there's a problem here, there's a signal, there's an alarm blowing somewhere. And it's like that with what you're trying to teach us. These things are there, and if we don't understand it, it becomes a problem in trying to recover the patient. Once the patient is not comfortable with you, no matter how good you are, you would not recover him.
No. The question is not comfortable. The question is that if you stimulate the gluteus muscle first,
yes, sir,
the neural network of the brain with the muscles will be disturbed. It's a neural network. You have to understand the muscle and the brain is a neural network. There are 4 sets of muscles, 3 sets of muscles in gluteus minimus, maximus, medius. And each area of the brain muscle is coordinated by the brain in a different way. So if you stimulate the gluteus muscle first, when you walk, you will have to take the support of the next limb muscles. You have to take the support of the compensatory muscles will become. This is what I was saying. It is the ego of the brain. Brain will never accept. If this is recovered, brain will not accept the recovery of this quadricep muscles and the hamstring and abductor muscles. I told you yesterday many times. I don't know why you don't understand.
You did so, sir. You did so.
The first muscle has to be treated is what? Rectus femoris.
Rectus femoris, yes.
Then comes, yes, then comes the rectus, this vasculatilis medialis. And if you follow this principle, in 1 minute the patient will start walking.
Otherwise, you have a bad beginning and you have to start all over again.
No, there is no recovery. For his whole life, he will work like a drunken gait pattern, circumdatory gait pattern. He will never recover. He will walk like this. His legs will walk like this. You make one mistake and his legs will walk like this for whole life. This is what I was teaching. And if you treat the quadricep and all, immediately his legs will start walking like this, like a normal person. Within 5 days, he will become a normal person in 60% of the cases. Such an important principle I was teaching, and I became so fed up that this is how your attitude of a physician. And he's a doctor who wrote to Danilo this. He's saying it is ethical, unethical. I tell you, hey, come and treat the paralysis patient first.
Well,
And teach
sir,
us the principles of
there are
paralysis.
doctors and there are doctors. We know that. So it's okay.
See, doctor does not give 1 minute. Wally, doctor passing from one medical degree from a college does not mean you are a person of neuroscience.
That is true.
You have no degree in neuroscience.
That is true. That is true.
Remember, you don't have a degree in
have a
neuroscience and you don't have the knowledge of neuroscience.
Even if you have a PhD in any other field, it's different. It's one PhD out of so many, and you're not in neuroscience. So, like I said, sir, there are doctors and there are doctors. Some people are not objective, they are always subjective. So, and for this, you have to have an objective mind, an open mind to learn. And you can only learn when your mind is open and ready to receive. When it comes in, you analyze, and then you go. So don't worry, sir. We understand. We are here with you. We know what is happening, and we understand. Let them do what they want to do. Huh?
No, but then I must give you a very much clarification. In Indian culture, we have gone in temple and we are taken an oath in our life that we will never marry anyone. All females in our life will be like our sisters, and all students of our life will be our children. So we have only one relationship in our life: brother and sister, and mother and son. That's it. There is no third relationship in our life. There cannot be any wife, there cannot be any prostitute, there cannot be anyone in our life. We have to come out from this sexual feeling. And when I came out from this sexual feeling, then only I could study so much.
So while we're at it, I hope you've been looking at my eyes to see the power so that we can do recovery for my eye too.
See, that is what I say. You can recover from your nails. I want to bring that perfection in you.
That is what, because I need to recover my eyes too. I want to stop using glasses.
See, one thing I want to tell you. I was having minus 25. One thing I want to tell you. I was having minus 25. I lost my eyesight by 80%. And then I recovered my eyes.
Yes, you said so.
I know those principles.
You had
Yes,
said
I know those principles. Yeah, that is why I'm teaching you.
Yes, sir.
In no way I have any intention to hurt anyone. In no way I want to take any money from you. In no way I want any physical pleasure from you. All these are away from our mind.
We know that, sir. And with Zoom, there is maybe when they get to 25G, then through the Zoom you can get physical pleasure. But for now, 4G, just video and.
No. One more thing. No. One thing before I leave the class. One more thing I tell you. Yes. There is an experiment which is going in Australia. Now they have attained the speed of how much, 44.7 terabytes.
Yes, per second.
Yeah. So what is the speed, You can download how many movies? 1000 HD movies in how many seconds?
In a very few seconds, because at that speed you can download.
1 second. 1 second.
1 tera is a lot of data, sir. And 47 is
more
than that,
Now you can imagine your patients, even today, the patients of Italy who have seen their physicians, they come and talk to me. Many patients from Philippines, they come and talk to me. And I say they are wrong prescriptions. And I say this is wrong, this is wrong, this is wrong. Follow this paper, follow this. Now what is the value of their prescription in the doctor's mind? Tell me. I receive so many patients from Indonesia and I correct their prescription and I see so many faulty things they have written. Who will respect you with half knowledge tomorrow?
Nobody.
Will anyone respect you with half knowledge?
No. You lose respect and position and everything, and you get a new job.
Yes.
Nobody's going to
This
come.
is what I'm saying. See, now today I tell you, I have attended 3 courses. One is Stanford University, one was Harvard University, one was California University, Berkeley. I keep attending these courses whenever I get time. And whatever I learned from there, I just give you that clue. I'm a senior professor. But then we don't want to put all this with our name, prefix, suffix, degrees, nothing required. Just be as simple as you can, because carrying this is a load. This is what I learned in my life. It took years for me to learn. Putting so many things in your name is a load. Make it as simple as you can.
It's okay, sir. It's fine.
And one more thing I want to tell you.
Yes, sir.
LAMP did not give me any money for this. Nor I took any money from LAMP. All what I went to Philippines was they gave me one ticket and food and accommodation. That's it. I did not take a single money for teaching these Filipinos in LAMP. I did not go to Philippines to make money. If I want to make money, I can make more money in my clinic.
That is true, sir.
Because I have a monopoly in India. I'm the only physician who can do like this in India. And India has a 4 times population of 4 countries.
That is true. You have population and you have people.
So before I cut down the connection, one thing I want to tell you, my intention is very simple. When I went to Indonesia, I thought that if I can treat this SPA case, Indonesians, and when I can treat Nigerians, how many people can recover? I just saw that my videos, people have seen my videos and they have done some techniques in the clinic and they have shown me the videos. And then I saw, wow, they have recovered the patients. And then the concept of my live videos carried on. You see, I don't carry about the ethics and all. I am the last person to carry the ethics, books and all. My question is, this is the patient. Patient gave me the permission. What the patient is doing, how the patient is recovered. A patient of spine surgery can recover in 20 minutes without surgery. Now, maintain your lifestyle. When you need to take a surgery, you do it. But for now, you have recovered. Take care of yourself. And in this way, we have recovered millions of patients.
That is true, sir, because I know you always take permission. I've seen your videos where you introduce yourself. This is MK Sastry, and this is a patient of this with permission of the patient for research purposes. We're videoing this, and I've seen that too. So we know, sir. We know. We who know, we know. So don't worry, sir. Let them go around in their circles.
Let them do whatever they like, but I wanted to give a clarification.
Empty barrels make a lot of noise, so we know they're empty. Let's leave them alone. If there was substance in them,
But before, say one thing before I leave, I want to tell you, it is the pattern of recovery of the muscles. If you follow this pattern, patient will walk in just 2 minutes. In 70% of the cases. What I told you yesterday was the recovery in 1 minute. What you say that paralysis patient cannot recover, follow my principles and you will get recovery in 1 minute in all the cases of infarct and all. Below 1 minute. We have shown you the demonstration with my cases.
Yes.
We have given you all these demonstrations. And the cost of the treatment is just below what? 10 American cents.
So you see what I was saying, sir. 10 cents and $500 or $1,000. There's a lot of difference. So the man who would charge $1,000 has seen you teaching people how to do what he cannot do for less than $1, and he's not going to be your friend.
No, 10 cents.
10 cents,
10
yes.
cents.
He's not going to be your friend, sir. He's going to fight you. So don't worry, sir. We have our prayers are with you. We're with you. Let them go. As my people will say, sir, no shaking. We are here. No shaking. Nothing will happen.
So say one thing I tell you. I'm not afraid if anyone is going. Let them blame me. I have no care. Because I always say these are the same people who crucified Jesus Christ. These are the same people who crucified Nur Fatima. These are the same people who crucified Galileo Galilei. What can I expect from them?
That is true, sir.
So for me, this is nothing. But then I wanted to give you a clarification that I have nothing to do with Arvind. I don't even have his phone number.
We know,
I'm not
sir.
even bothered.
We know.
I was just asking what is his feeling?
Yes.
How will he behave?
Yes.
And this feeling is developed by what? Neurotransmitters.
Transmitters.
It's the action impulse and the chemical impulse. When I speak to him, it reacts in his brain. This reaction you have to understand. Because when you speak to paralysis patient, you have to find out this reaction. When you speak to him through his relative, you cannot speak to the paralysis patient, you know. You have to speak to the person through whom? To the non-face, non-voice. If you speak to him, all your data are incorrect. So, when you want to ask something, you have to ask for the second party, not the first party. And your voice should be low so that the patient is not disturbed by your voice.
That is true, sir.
So these are some principles. If you understand, you recover patient in 1 minute, or else you put the patient for 10 years, you will not recover. Make one mistake, and he will never recover. And one thing I tell you, I am the follower of Islam, and the follower of Christianity, and I am the follower of this one. So by following these principles, I cannot accept any, because I am a staunch Hindu, I am a staunch Christian, I am an Orthodox Islamist. Being a Hindu also, I always do Ramjan. I did 20 Ramadan this time. In spite of my bad health.
Health, yes. I was going to with your
You should
health.
all
You've done so much.
Yes, you should all know that I'm suffering from a cancer disease. And I don't know how I survived, because I survived 5 heart attacks. Any one more heart attack and I'm dead.
No.
My heart is working less than 45%, and still I can do well. I believe that it is God's grace. So my only thing to do, all of you, is that be honest, dedicated, pray to Allah, take care of yourself, work for your clinic, and even death cannot touch you, because you see, after having 5 heart attacks also, I am okay.
That is true, sir.
I have taken the highest risk, you know, my saturation level was just below 90, and I was treating the patient, and then I said, now what is my saturation level? So it is 89. I said, make the ICU ready. Once I complete the case, put me in the ICU. You only know one part of Sastry. You do not know the whole Sastry. How I operate the case, how much surgeries, how much working we have done. You don't know that. I've only taught you one part. You should know that I have changed 3 names. Because why? I followed my teacher. My teacher said, now you give up your name. Now you give up this, you give up this. An Indian constitution allows me, the Indian law allows me to change my name. There's a proper procedure, legal procedure, and I did it. Why? Because I do not want to associate with my past. My past was past. My present. I all believe in what? My present. My present is beautiful. And why? Because I can recover so many patients with no cost. One Botox injection cost how much? $1,000. And my treatment is how much? 10 cents. We're using dextrose saline injection. And I'm a pure medical physician. But then I don't want to prefix all these things. I'm just a normal person. I want to live a normal person. I practice acupuncture, but I say now I don't like acupuncture because it has some limitations. You all have to practice a higher science topic. Thank you so much.